hello, bonjour, buenas, hello, buenos dias, guten tag. My name is Marion Pitters, and I'm delighted to be the facilitator for today's webinar. I'm here to introduce our expert speaker, moderate some questions from you, our audience members, and ensure that the webinars progress according to schedule so that we respect everyone's time. But first, on behalf of McMaster University, it's my pleasure to welcome you to the 6th seminar of the series, The Arctic, A Global Health Perspective. We have participants from all over Ontario joining us an hour earlier than usual. And we have graduate students and faculty from McMaster and partner institutions and representatives of the World Health Organization and some selected invitees. Many of you are preparing to contribute your skills to Arctic global health. We welcome you all to today's compelling session. This webinar series explores diverse perspectives on Arctic global health. Despite documented health disparities between the circumpolar north and other regions, the Arctic remains an underrepresented area in global health research. This series offers a transdisciplinary look at key global health challenges and opportunities in the circumpolar north. A quick overview of the 10 webinars in our series can be found at the Global Health website. So today's session is webinar 6, the effects of health policies and local interventions on health outcomes among the Sami in northern Norway. It features Lars Helender, a psychologist in northern Norway. Time's been built in for questions and discussions at the end of the presentation. Please use the chat tool to submit your questions electronically at any time during the presentation. And note that while we may not be able to get to all of your questions, we will aim to address them afterwards on the Global Health website. This webinar series has been inaugurated by Dr. Andrea Baumann, Associate Vice President of Global Health and Director of the WHO Collaborating Center in Primary Care Nursing and Health Human Resources at McMaster University. Andrea, will you please start us off with a few words about launching this webinar series?
Thank you, Marion. I would like to welcome everyone on the webinar on behalf of McMaster University. As Marion mentioned, this is the 6th lecture in our series. We're very looking forward to hearing Lars Helander and his perspective of the issues of mental health in the north, in particular to northern Norway. And we can compare from our Canadian perspective as well. This is an exciting lecture, and it's coming from us directly from the Arctic, which is great. So without further ado, I'll pass it over to you, Marion, to continue. Thank you.
Thank you, Andrea. So today our guest speaker is Lars Helender. Lars is a psychologist specializing in adult psychiatry, suicidology, and community psychology. Lars is a Sami from northern Norway, having worked as a fisherman and also in reindeer herding. He's a father of 3 daughters and is working in outpatient care in Tromsø. When not working over the past 15 years, Lars has been actively pursuing mixed martial arts. If you thought our previous speakers had fascinating hobbies outside of work, MMA must surely be at least one of the more unusual. So Lars, thank you for presenting for the next 30 minutes on health policy and its effect on Sami health outcomes. I'll provide you with a 1-minute reminder, and then we can move into a discussion with the participants' questions that come up in the chat section. Over to you now, Lars.
Thank you. Wanted to hear someone reviewing myself. Okay, my name is Lars Helander. I'm a specialist in adult psychology. I will try to talk about health policy and how local intervention have worked among us Sami people. My main focus is on suicide prevention. Yes, my name is Lasse. I'm 30 years old. I'm from northern Norway, in a small sea Sami town called Unjarka by the Nidgo River. I work now in an emergency psychiatric clinic for the North Sami area of northern Norway. Experience the obstacles with giving emergency psychiatric healthcare to Sami people on a, if not daily basis, or at least weekly basis. So I try to have that perspective, but I will also talk about like outside examples of local intervention, but like what is the obstacles, not for just us Sami people, but for like people, nature people who work in nature. What is causing like bad health, and what's the obstacle of getting help? So I try to talk about that too. Yeah. So first I will introduce like who we are, or the Sami people, and what I see as the challenges with not only access to healthcare, but how we ourselves utilize it. I will also talk about like how the colonization have affected us, and how it's still in our mind, how we still are not have like some disbelief to the government, but also to the government representatives. Often it's doctors or lawyers or psychologists working in small places who are like the one with the higher academical education are often those that are like, at least when I grew up, like the closest you come like someone from the state. You have like a built-in skepticism towards them on the history of what our forefathers have experienced. Yeah, I will also go into the research part, how hard it is to gaining knowledge about health among Sami people, but that is also generalized to indigenous people in general, because indigenous people are often register as members of their state, and so are these often neglected in bigger population studies. And also short Q&A at the end. So when talking about Sami people, we are an indigenous people, and we like to I build up like the knowledge base from what do we know of indigenous people health and what is the living condition. So I just like I would recommend that to get like an overview of the challenges of indigenous people, and the challenges of healthcare and being a healthcare worker among indigenous people. So who are we? We are the Sami people. We are indigenous people. We reside in the mid and northern part of Norway, Sweden, in Scandinavia, and also Finland and the Russian Kola Peninsula. We don't know how many we are. There's never been studies there like population counts, so we have no idea how many we are. After the Second World War and the focus on ethnicity, there's have been like policies that we should not collect data on ethnicity, and that's like maybe a good thing after what happened in the World War, but it also vulnerable minorities or indigenous people, I think, have been neglected because of that. Most of us residing in Norway, we think, although there are many in Sweden, and inside the Samis we have different cultures and we have different languages. My girlfriend, she's like from the south of the Sami areas. She's a Oriel Sami, and I don't. When she speaks, I don't understand what she's saying. So our languages are very different. It's like, how can I compare? Maybe like Norwegian and French. Like there are some bases and maybe some words that are similar, but it's like they had some 1,000 years apart developing, so it's not possible to understand each other. We have also like Ubme Sami culture is a little bit north. We have Bidum Sami, which is a dying culture. Almost no one talk it. And we have like Yulev, and the biggest one where I'm from, it's the North Dalvi Sami culture. It's the North Sami culture, and that is like when people think of Sami people, they think of the North Sami people, even though it's a generalizing thought, or it's kind of a generation towards Sami, but yeah, that's how it is. And we are recognized only in Norway as indigenous people. So I will talk also about how the state is committed to give healthcare to Sami people on the basis of being an indigenous people. So the picture there is my great grandfather. I had that picture hanging on my grandfather's wall, not in color, it's been colorized later. And it was a part of the French Prince Roland Bonaparte expedition, on where he was when the time of social Darwinism, and they took measures of Sami people heads because they believed that our forefather was like the missing link between modern human and more like ape humans. So we have been in human zoos, and they have been a focus of research until, like, I think, after World War II, it was then that there hasn't been like that kind of social Darwinistic focus since, but then they've become the modern academic social anthropology studies. I don't think that has been a little bit better, of course, but it's still like a downward view on us people. So we're skeptical to researchers from universities, much because what our forefathers and mothers have experience with measuring of skulls and having to get undressed naked towards researchers. And as I know that many Arctic indigenous people have had the same experiences, that their forefathers and mothers have experienced the same, like, I don't know what to call it, like, horrible experience that they have to get dressed naked in front of strangers and measured their whole bodies. But at least we got a photograph of our forefather because they took good pictures. And at least for the past 150 years, there's been like a assimilation process that Sami people should talk Norwegian, not Sami, and should walk in Norwegian clothes, and should let go of their religion and culture. The part of religion that we should not use our nature religion started much earlier, from around the 1600s. That's also part which the witch burning process in where I'm from is the most extended in the world. They burn like witches here for 200 years. So it's a bad history. And that's like, I want to share that message because it's important to know there's like a background, a history that many of these people, it's not like, oh, we don't want healthcare, or we don't, it's not that they neglect like lifestyle advices from the government and such. It's just that there's been hundreds of years with bad experiences, mistrust, and forced how can I say, like like forced Norwegianization, like forced assimilation, and I think that have affected the minds, and it's like a, I know, historical trauma. So, and also education and health services and church authority, but also that was from the major population, the Norway population. So I think that affected that many didn't wanted to take higher education, and they have didn't believe the doctor, or was afraid that the doctor did not good things. There also was like they sterilized Sami people, like my granduncle died last year. He was sterilized by the local doctor. I think that is doing something with the minds and the attitudes towards healthcare workers with that history. And I don't think that's unique for Sami people, but from Arctic indigenous people in general. Yeah, the Norwegianization of Darodutin. This is also my great-great-grandfather. Yeah, it was, as I said earlier, a political goal to let go of our own culture and became Norwegian. So, I think I'm giving this like background info to like because it's important to know the history. If you are a healthcare worker from a majority population, which we often are, even I'm a Sami, I have education, I'm like more important than them in the major society size. It's the right word, but maybe many feels like them if they don't have education as such. It is important to know the background of the people, and that you have like cultural competence, that you have cultural knowledge, and that you are aware that of the fall pits you can go to when you're a healthcare worker. So I want to share that message, and that's why I always start my lecture with the history of Sami people and what's been misdone. So we're like a nature people, like Arctic indigenous people are. We do reindeer herding, which like many other circumpolar people do, and we also do a lot of hunting and gathering, fishing, picking berries, and that's like that's like what people do even now today. Like my father, he likes to hunt and pick berries, and that has no big value for the Norwegian society or the majority society. That knowledge about in where the fish is and when you're going to fish, it's not like it doesn't have so much value. You have to like create that. And I think that's I think that's a part of the mishealth, or the part that's when you see there's like some disparity in health or in mental health problems or social problems. I think there's like also that the cultural value system is not so has not the same worth among the majority as it is among Sami, if that makes any sense. So but at least for the last 50, 60 years, there's been revitalization, that people themselves have gone out of their like internal racism and starting to believe that, oh, this experience of knowing where the good fish are and when the berry is getting ready to be picked. That's like, it has values. And there's been like a revitalization process that building up the Sami identity, and yeah, I don't think nation building, maybe we can say that too, but at least an identity. And I'm born in the 1980s, so like my father generation has been like the one that putting the foundation that I grew up being proud as a Sami. Like, it's been natural for me to wear like our traditional clothes and listen to joik or music, but it's not the same for the older people. Yeah, as I said earlier, there's like different Sami society, and there's like, I think that's like the same for most of the polar indigenous societies. There's like clusters of people living. Like for us, we have like clusters in the inner part of Finnmark, the northernmost county, and we have also a cluster where I'm here now in Troms. But like the South Sami, the southernmost area, it's like it doesn't have like a core area. There's people just living, few people living here and there, and so that's like a obstacle when you're going to give healthcare to South Sami that the Northern Sami doesn't have, because we live like in a cluster. The South Sami is living spread, so we can just make like a South Sami health center, because that will be maybe 1,000 kilometers away from where some Samis live, and so it's like it's different obstacle for the different Sami area when it's come to getting access to healthcare. And at least the white area here, which is Sweden, Finland, and Russia, because Sami people, they at least reindeer herds, they move across borders. So like when I had patients in southern part of Norway, and I was going to have like a polyclinical session with them over phone or over Skype, he was suddenly in Sweden. We couldn't have that because it was so expensive using the mobile net in Sweden to have conversations. So it's obstacles across land borders too, and those borders are also artificial and hard to relate to for many Sami people, but it's still there. We as healthcare workers really get to feel there. Okay, when my patient goes to Sweden, he's in Sweden. I can go after him and give him healthcare. I feel that when I look at other people and starting to learn more about other indigenous people, I saw that there was like a similar fate, or when now I'm focused on negative side, but like there was like a forced colonization or assimilation process, and there's have been rapid social and cultural changes. As I was saying earlier, like with my father who likes to hunt and pick berries, like that value system he was trying to teach me maybe doesn't help me so much in the city life I'm living, or in the small town I'm living. It's like there's been so rapid social changes and cultural changes that for 80 years ago, where I'm from, there was no stores. There were no places you can go and buy things. Now, or maybe 90 years now. Like before World War II, there were no stores. So people have to get all their food by themselves. And there was also like a big, the life evolved around that. And if we fast forward to 60 years later, 80 years later, 90% of the population work in administrative or healthcare services, or maybe not 90, but 80%, and the rest is working like in reindeer or fishing. But I think in 60 years it's too fast that you lose meaning of life, and I truly believe that that has some explanation why we see some high suicide rates among indigenous people, because many people who grew up with parents who has their set of life, and then you see maybe because of climate changes, maybe because of digging mines, or different things that abrupt the way your fathers or yourself relate to nature, or you can't just gather from the nature like you used to, or you're living a different life. Maybe in the city, you have moved to the city. I think that the changes there are too fast that you may lose meaning in life, and are vulnerable to don't see the worth of it. So I think that's a part of the explanation why we see higher suicide rates among Sami people, at least. Yeah. So what was going to talk about? Suicide prevention. Yeah. As when we have formal status indigenous people, we have right to equal service in treatment, in healthcare and treatment, and we don't have that in reality, but on paper we shall have it. And there also, as I said earlier, there's like challenges with we being like we don't care about borders. Like these invisible borders is hard to relate to, but so the healthcare workers from Norway maybe don't talk about healthcare workers in Sweden, even if you know you have a patient that's having reminiscent thoughts, and you should really want him to be followed up by a doctor in Sweden. It's hard to communicate, but we are getting better doing that these latter years. But the national borders is a real challenge towards suicide prevention. So I will give an example of how a Sami institution have risen by demand, unfortunately by real demands. The small town in the inner part of Finnmark called Karasjoas had a wave of suicide starting in the early 1980s and lasting like 10 years. Most of the girls and boys that was born in 1968 and 1969 died by suicide. So it was just getting, I think it was, I don't know, between 20 and 40 suicide in a 5-year period, and it's like living like 2,000, 3,000 there, and it was young people who took their life. So the doctors there, my former colleague Ragnhild Steen, she couldn't handle it anymore as a doctor. She said it was the worst thing she has ever experienced, that people she had a conversation with one day just took their life the next day, and it was so many. So they contacted the county, those who was leaders in the county, and asked for help. They got a little bit extra money, and it's starting to make like youth offices they're starting to really put research together and make a team out of it. And it was the school, who was like a central institution, played a big part of it, and also that they use like the whole family, and the doctors had talked with the great parents, the parents' generation, and the school and youth office, the newly rising youth office, took care of the youth and like monitorized it and like working hard to give them good healthcare. And I don't know if healthcare is the right word, but like give them good information about what suicide is, but also like be there if somebody wanted to talk. That's, I think, was the most important job to them. So in the 90s, they got money to put together their own Sami psychiatric youth, and that's the first psychiatric or mental health service specified towards Sami youth or Sami people in general. And that was like the first step to getting like a specialized healthcare for us Sami people. And later it becomes SANGS. It's the Sami Norwegian National Advisory Unit on Mental Health and Substance Use. And now today they have national responsibility to develop mental health and addiction treatment service for Sami people. And as the government recognized there's a need for culture specific healthcare, they have gotten like a part of the health budgets, and now is a part of the hospital trust in the northernmost county, even though it has national responsibility. And now today they're even like their own clinic named Sámi-led. So that's an example how it started with a suicide wave. It started with doctors, teachers, nurses coming together and making like a holistic. I know it's just called health, but like a psychosocial healthcare offer, and to being like something that is a part of the public healthcare, which it is today for all Sami people. So even though many died in the suicide waves, I like to believe that this was not for nothing. That something good come after it, and that was SANGS, our own psychiatric healthcare system. Okay. There was another project between SANGS and the county administration, and it was training, suicide intervention skills training. I know this has been done also in Canada and some in Alaska. And that was also just like increasing the public knowledge about what is suicide and how to prevent it. Because I don't know if there's been like evaluation of it, but I know even my mother said today that she learned a lot from that when that was going on. So I will also talk about the personal project. It's from Dieno. It's or my neighbor county. I'm from a place like across the mountain from Dieno. In 2005, 2006, there's like 12 suicide among young people in Tana. There's like 2,000. So that's really high numbers. So it started like just like in Karasjok, it started to be a demand for, okay, we have to do something. Even though it's many years later, it's better than nothing. And they build on what they had. They involved the Sami psychiatric healthcare system and build it like a culture-sensitive prevention approach. And they try to have in mind the history of colonization and try to anchor it locally, and that the commitment came from the local community itself and not being forced upon them upwards and downwards, like a ground-up approach. So they try to use like internal experts, and that the people with knowledge was just from outside with just external partners. So they find the internal expert on the fjord fishing, and here he was. He's Lavnjark Yngve, we call him, and he was like the main guy was asked, okay, can you arrange this? Can you do that? And like a lot of practical work, but also like a guy that was driving the thing forward. And that was really important, that it came from within. It's and also that it was on Sami and not on Norwegian. That it was that the guy leading it was a Sami speaker, and the information was on Sami. And it was about knowledge, or what is suicide cluster, what's suicide rates, and putting together knowledge from the suicide rates from Karasjok and the earlier project, and like using it in public and have people talk about it and talk with their kids. So my main message is that we need culture-sensitive suicide prevention. As a Sami myself, I feel like it's so important that it's recognized, that our culture is recognized, but also our language. It's hard to express ourselves on different language than our mother tongue. And I just want to sell that in. That's so important to have like respect for the history. And if you're going to work among Arctic indigenous people, put some minutes or hours in to learn about the history. Not to over-empathize it and just see everything in the negative, horrific way, but just to be aware of the traps you can fall in as a healthcare worker.
Lars, it's Marion here. Yeah. Rudely interrupting you. There's about a minute left or so.
Yeah. Thank you. Okay. I just want to say that beware, not just become with research, but also when working as a healthcare worker, have like a bottom-up approach and not being the expert who have all the answers. And like with all groups of people, beware of stereotypical thinking and categorizing. And if you're working like as a community worker or a social worker, cooperation is key to having a success. And even if you have read a lot on the subject, don't be the expert. Yeah, and we believe that interdisciplinary is key to at least suicide prevention. That education, healthcare, and social work goes together. strengthen the community and strengthen to hinder more suicides. But we also look at individual, but from individual to the community, and we have to work on all those levels. And there seems, at least, that we need more voice. We need to be heard. We're crying out. We have some problems, but sadly we don't get heard by the government. But things have gotten better. I'm not just complaining. Okay, maybe 10 seconds more. But yeah, that was that I wanted to share. It's I have experienced loss of a little sister and stepfather by suicide, and it's personal to me, working with suicide prevention. So I'm glad that I got to talk a little bit about that. Yeah, I think that's all I have.
Lars, thank you so much for that insightful presentation and your observations. Really helpful to our understanding of the background of Sami culture, and also the history of what went on there. We can certainly relate to that, being Canadians, of what's happening in our north. And now I'd like to get to some questions. So everyone, now that you've had an opportunity to hear what Lars has said, be sure to submit your questions in the chat section, and we'll pose those questions for Lars. So many things come to mind, Lars, about your presentation. What should a person do if they experience a suicide cluster as a healthcare worker? What would be some steps they should take? Can you comment on that?
Yeah, I would just like I have experienced this as just being not a healthcare worker, but just like being a person in the society. I believe it's important that you, first of all, you just have to like make rooms and make places to meet, like make it possible to have a conversation about suicide, and that you're just like a facilitator. You're not like driving it, but you facilitate it, and you try to have someone in the community that maybe have some insight around it and can talk about this, like cooperate with that. As I mentioned earlier, cooperating is key there. So I believe that's important, like just make the conversation possible about what to do, and have the community themselves talk about it. Even that maybe it sounds easy, but it's hard to do. It's hard to have 10, 20, 30, 40 people meet and talk about it. So.
In terms of talking about it, you used the term strength and resilience in your second point on the slide here. And I just wondered, is there a word in Sami languages that would equate to the term resilience? Do you have a word for that? Or is that a word from the South? I'm just wondering how you translate culturally. Is that a word from the South, or that people might be skeptical about, or is there a translation into Sami languages for that particular term?
Yeah, maybe I can use the words Jespergi, that Jespergi means that like when you're on the mountain or on the sea and it's hard weather, you have to get by, you have to survive this. And I know if I would have, and just translating, I would have used the word to Jesperge, to cope with it, to get hard, resilient. I know if I think I would use that word. And when I talk with my patients, when people have tried to take their own life and they have survived and they don't know what to do, I like to use that word. No, you have to no, you have to get by. And many, especially men, that's what I need to do now. I just collect what I have and focus what to do next. So
Lars, that's one example of terms that you might use in psychology or psychiatry that you would then translate or use in a way that the Sami peoples could relate to. How much of your practice is you thinking about that, or is it easier to make the cultural transition without raising skepticism? How much of your thinking is around language in your practice?
Yeah, I know. Before I worked at SANGS, the Sami psychiatry, and there was a lot of focus on it, and it was it's important to speak Sami, but now I work like in a Norwegian system. Even though we have many Sami patients, there's like no focus on it, but I see the patient themselves, they want to express themselves on Sami language, and by using Sami words, there's like another mindset to talk about things, and we don't have the same words or feelings. So it's the language is really important, and I try to highlight it to my leaders and saying we need more Sami healthcare workers.
Mm-hmm.
So, but also even if you're not Sami, just to say hello, just on the language, it means a lot of, especially for old people, that you can say hello on Sami language. You say "Bare baby" and not hello in Norwegian, especially because of the history with the colonization and the forced assimilation. So when they meet a healthcare worker that are bothering to maybe not trying to learn the language, but at least say goodbye and hello on the language, I think that's great. So, but it's hard. It's hard to make people just like understanding that such a little thing is also important.
Mm-hmm.
No, we need to diagnose, we need to check their sleep and how they eat and everything, and that they get the medication. Yeah, that's also important, but it's important that we recognize them and that we know some few words. So yeah.
One of our participants is picking up on what you're saying are the hard parts, and this individual is saying, "Thank you, Lars, for sharing your knowledge and compassion from the heart. That's the hardest part, and your courage is great." And the question from this individual is, can you please say a little bit about keeping the spirit strong?
Yeah. How can I translate? Maybe it's like I know when we grew up, I think that's for all human beings. And we're remembering when we were cold or hungry, and our great grandparents or grandparents or fathers and mothers said encouraging words to us. I believe that's internalizing as we grew up. Like, okay, and then you get like lift up your resources, and okay, we're just going to walk some 5 kilometers more, and then we're at the fishing place or whatever. And when you like talking to that part of the human, or at least when I'm as a Sami psychologist, talk to that part in an emergency psychiatric setting. I like to I don't know, to lift up that spirit when you had when your children and your grandfather said, okay, you see that top over there, you're going to walk over there, and then you see that place, and that is where my uncle saw the reindeer. Just like, that's what I mean when I'm keeping the spirit strong, is that I'm trying to wake up the emotional memory that many Sami people have from their childhood, when they're being told that they have to be that they have to do this, they have to get by. I don't know if that was answering the question.
Thank you for that. Yeah, I think we all have memories as children of similar type of experience at some point.
Yeah, and that there was something that awoke us, and that we stayed in the tough spot, or it was shitty, it was cold, and we was crying, but we made it through the day. And when we look back at it, it was hard, but
so there's something in that story that you're relaying where the role of relationship is important. It's a parent or a grandparent that has that role of keeping your spirits going. And is that purposeful in that story, in that the role of relationships in your practice is key?
Yeah. I try to, maybe I have not like self-reflecting on it, or the Sami people, but like I heard about what is called like cultures like from the East, they focus on the individual when they're describing themselves. No, in the East, but on the family when they're describing who they are. And we're like the same. Like my name, I use my mother's name before me when I introduce myself. So I say I'm a mother, and then my name. And so it's, I think that those roles are important, and by boarding schools and by like hard time where parents grew up, I think some of that has been destroyed, and some have traumas and such, and they didn't have the natural father and son or daughter father relationship because of their father went to boarding school and did not only knew Sami, but and all the people spoke Norwegian, and he was afraid for 10 years, and that's why he drinks a lot today. Like, I think, I think that role is important, and many people have lost that, but they still have. There's always like a collective cultural, and I talk about that you have to put it through and bite your teeth together. Everybody knows what I'm talking about.
Okay.
They know that feeling.
Okay. Another question that also goes to how the Sami live. You mentioned that the Sami are a moving population between borders.
Nomad people.
Yeah. You also mentioned that there's similar healthcare projects in Sweden and in Finland. Do the Norwegian Samis have access to those healthcare systems? So when they cross a border, either into Sweden or Finland, would a Norwegian Sami have access to their systems, or is it limited that, okay, if you live here, then you have to go into this system, not by crossing a border?
It depends on the doctors. If they have a good doctor, or at least a Sami doctor, I know in the southern part of Sami, she called the healthcare system in Sweden and said, okay, I got the patient here. He's a reindeer herder. He's going with the reindeers to Sweden, and he's drinking a lot, and I don't think he's having, and I'm afraid that he hurt himself. He will going to hurt himself. Can you please call him and check up on him? But that's depend on the practitioner or the healthcare worker that is being in contact. If there was just like a substitute doctor from south of Norway, he would not care. I don't think he would. And also, there's also a obstacle when communicating, especially among men, when we don't say, "Oh, I want to kill myself." Maybe I say, "Today I woke up and it was not a good day. The sun was not shining." It's like the way you communicate. You don't communicate indirect. So it's just like this obstacle in communication. But that's a whole other story. But yeah, in Norway, there's songs where I worked before. If Swedish or Finnish Sami people come to Norway, they can get health care from Sami psychiatric care, but not the other way around, only in Norway. And I think that's because we're recognized as an indigenous people only in Norway.
So in Sweden and Finland, they're not Sami are not recognized as indigenous. Is that what you're saying? Okay.
And in Russia, you get arrested if you're demonstrating towards it. So.
Well, we'll be politically correct and not comment on that.
Yeah, I think so too. That's on me.
Other than border obstacles, are there other sort of current day obstacles that you're encountering in terms of giving mental health services to the Sami people?
Yeah, like last week I got a man in his late 50s, only speaking Sami, and have traumas from when he was in boarding school, and he was put in forced observation for psychosis. And because of the traumas from boarding school, and that everybody speak Norwegian towards him, I was not getting a valid observation of his psychotic symptoms. Because, as you said earlier, this is like reliving the hard times I was having when I grew up in boarding school, not knowing the language, and so it's like the institutions itself is an obstacle, and also I have it the other way around. 1 month ago, I got like a old Sami lady, and she was, "No, I speak Norwegian fine. I don't need interpreter." And nobody understood a word, because they want also to be Norwegian, and they have heard that they are Norwegian. So, and they're kind of trying to be proud that they speak Norwegian, but Norwegian sucks. So, and if you get the interpreter there, it would be like, it would not be good, because then it's like saying, it's like stepping on those the self-esteem. So that, and then it's good to have Sami healthcare worker being there. So she was lucky I was on the job that day.
Yeah, I think there's a number of people that are lucky to be able to encounter your services, Lars. Just quickly before we wrap up, one last question I'd like to sneak in. An individual is asking, are there that the suicide of close family members would have an impact on mental health of their immediate family members? Are there services to support family members?
Yeah, it's coming lately. I think there's even an English documentary about that. I can try to send the name of the documentary to you later. But yeah, there's like Sami psychiatric healthcare is going on the mountains and try to find the family and try to talk with them, and the experience they made, that it was not good sitting with all the people in the same room, that they should come out one-on-one. But yeah, nowadays there is support to those left behind. But like in the 90s, 80s, there was nothing like that. It was only if the doctor was saying, can you please come in tomorrow again and we can have a talk. But nowadays there's better services to those left behind.
Lars, thank you so much for a very sensitive and compelling presentation. And I want to thank everybody for their compelling questions. Let's wrap up very quickly. We hope that the information and discussion was relevant and useful in expanding your perspective on global health in the Arctic, especially around mental health today. And we look forward to hosting the 7th webinar entitled Community Engaged Research for Northern Sustainability. That will be held on Monday, March 22nd from 10 to 11 Eastern Daylight Time. It features Dr. Gita Lubitschek, the Associate Professor, School of Earth, Environment and Society at the Faculty of Science at McMaster University. So enjoy your day, the rest of your day, everyone. Again, Lars, thank you so much for your presentation. And we look forward to everyone participating in our next webinar next week. Thank you. Merci. Gitu.